Hi, my name is Chris, and I'm with the British Columbia Lung Association, and I'm very pleased to be sitting here with Dr. Hind Sbihi. She's a postdoctorate fellow at the BC Children's Health Research Institute.
Correct.
I got that right.
Yes, you did.
So, we're here to talk about some things around wood stoves.
Correct.
So why don't we talk about what was the intervention that you evaluated?
Okay, so well, first of all, thank you for having me. It's a real pleasure. And so what happened is that in the northern communities in BC, wood is a primary mode of heating. And when that happens, that means that wood combustion becomes something that is going to impact the air quality in the communities that are heavy on using wood, right? So there were complaints in 2007 around the air quality, and there was also more and more research and evidence showing that residential wood smoke had really big health impacts on people's health, and mostly cardiovascular health, and it's a big area of research. Now, the province took the initiative to come up with strategies to reduce the impact of wood stove and residential wood combustion on the air quality. And what they did was inspired by strategies that have worked elsewhere. And so I'm thinking, for instance, there's a very known community in America, and it's in Libby, Montana, where that was a mandatory exchange of wood stoves, and they've changed over 1,200.
Wow.
Yeah. And that led to a decrease in PM 2.5, which is the particulate matter of fine particulate matter. The decrease was between 20 to 30%. And most importantly, the decrease of a substance called levoglucosan went down by 50%. It got halved.
Wow.
Now, what we need to tell our audience is that levoglucosan is the gold standard for wood smoke combustion. So what we did then, because the province took this initiative, the Ministry of Environment put in bylaws that was encouraging people to change their wood stoves, because the Ministry of Environment got the money to give people incentives, financial incentives, to opt into the program. So the difference here is that it is an optional program. People have to buy into changing their wood stove. When that happened, that gave us researchers and the BC CDC the possibility to actually take advantage of this kind of like almost natural experiment. So people are going to hopefully buy into it, get their new wood stoves that are much better at burning in a more efficient way, and creating less problems with the air emissions, and maybe see how that impacts people's health when the wood stoves are exchanged.
Perfect.
Yeah.
So you've touched on some of this already, but what was the impetus for this intervention, and who was involved, and was it for a specific area in the province?
Absolutely. So why don't we look at this slide I wanted to show you. This is from the 2014 air pollution emission inventory, and what you can see is the percent of emissions. And basically, the highest anthropogenic source of PM 2.5, and so that means the sources that are made by us humans, the highest one is the residential wood combustion, right? That is higher than all of the emissions, all of the industry combined, and higher than the emissions from all of ground vehicles and marine vessels. In fact, the only emission source that is exceeding the residential wood smoke is road dust, right? So those first two columns. So this is the impetus, right? This is the problem. Residential wood combustion is the biggest PM 2.5 emitter, right? And in northern BC, those are higher, mid and high latitudes. As I told you in the beginning, the people use a lot of wood to heat their homes. So so there's the Ministry of Environment, which is the province, and then the BC CDC, the BC Center for Disease Control, and then UBC, as well as SFU, so different universities, researchers. So it's this collaborative effort between
Very good.
the ministry, agencies, and the research community coming together to put this program into place.
That's really good.
Yeah.
Now, what sort of impact have you seen with this intervention on the air pollution, obviously the wood burning, in specific communities?
That's a great question. So let me take you to this this slide, because this really shows the provincial effort. Okay, so this is all the communities in the region where the wood stove exchange took place. And if you focus on the 4 communities that my research has been looking at, which are Talquah, Smither, Houston, and Burns Lake, they represent a big chunk. So a total of just under 700 wood stoves were exchanged between 2007-8 until 2012-13. From these 690 something, about 442 wood stoves were exchanged in the 4 communities that I just mentioned. So this gives you some context, right? Now, what does it mean really? What you can see is, if you look at this graph, so on the x-axis you have the cumulative percent stove exchange, so you can see over time how much is being exchanged. On the y-axis is this ratio of level glucosan to PM2.5. So let's recall here, level glucosan is my gold standard for wood smoke. My PM2.5 is the amount of particulate matter in the air, right? So it is really a marker of the contribution of wood smoke to the air quality. So what you can see is that the contribution of wood smoke went down over time, which is an indicator that the wood stove exchange program has been quite efficient at reducing the contribution of residential wood smoke to the air quality. Now, you might also take a look at the last 2 years where we see some plateauing effect, and that is probably due to citizen fatigue. So in the beginning, when the wood stove exchange took place, there was this big energy going on. The communities were really buying into it. There was a social marketing campaign going on. And with the years, it seems that this energy seems to have dwindled a little bit. Yeah, and there's also the financial aspect. So the MOE, the Ministry of Environment, had a lump sum that was good to get the program going, but these type of exchanges need money, right? And so maybe this shows a need for some more financial influx. Yeah.
Now, did you find, you mentioned several communities that you were doing this in. Were the results similar across all the communities?
So that's a great question, because this is what is going on right now at UBC. We have a few graduate students, and I'd like to mention Matthew Wagstaff, who is a master's student who's doing amazing work looking at doing mobile monitoring. So what it means is that he is driving in different wood combustion impacted places in the province, and trying to get an idea, and a quantitative idea of how much wood smoke, and if there are hotspots. And these communities haven't been targeted, some by the wood stove exchange program, but might be. So if we find that they are good candidates, that might help the Ministry of Environment to make decisions about which communities might benefit the most from such an exchange.
Absolutely.
Yeah.
So it's really nice to know that we're having that sort of progress right here in our own province.
Absolutely.
That's sort of all the time we have right now. So I really want to take this opportunity to thank Dr. Sbihi for being here and taking this time.
Thanks.